this lesson, we're going to discuss admissions, discharges, and transfers. Okay, so when we first think about the admission process, the first thing we need to see is the patient inpatient or outpatient. That helps us set up the plan of care. It helps us think about education. It helps us in planning in terms of treatment and discharge planning, which we're going to talk about in a few minutes. When we admit patients, there are some key things that we're going to need to do. You're going to need to introduce yourself. You want to identify the patient using two patient identifiers. You want to get a set of vital signs. You want to assess your patient, and then you want to orient your patient to their room. By introducing yourself early, you get to help ease your patient's anxiety, and you get some insight as to what's going on with your patient. One thing I want to highlight here is the importance of doing what we call our baseline assessment. Take your time to thoroughly assess your patient. Be efficient, but make sure that this thing is solid. It creates a better foundation for the care that you're going to give later. Now that we looked at some things that you'll actually do for your patient when they're admitted, let's look at some concepts and planning for your patient. The things we're going to talk about here are RN driven. So you can delegate tasks like vital signs, but for this part of the admission, it's on you as the nurse. So the first thing you're going to do is get a health history and admission assessment. The health history and admission assessment are very similar to the health promotion assessment. So go check that lesson out to get a better idea of what I'm talking about. So you'll ask your patient if they're on any medications and what they're on, or if they have any allergies. You'll develop a plan of care and evaluate your patient for education purposes. You'll also make sure that you've got an order from the provider to be admitted and to what unit. Sometimes you'll have like standing orders, and then sometimes your providers will have to put in like special ones. But just check your unit to where you're working to look at the particulars. And then you'll do something called discharge planning. The big deal with discharge planning on admission is it helps to identify the necessary resources that the patient is going to need when they get home. All of these things should be done in 4 to 6 hours once the patient gets on your unit. So discharges. When we think about a discharge, the first thing we should ask ourselves is the discharge appropriate? So can the patient eat? Can they void? Can they get up and go to the bathroom? Do we need to set up some follow-up care at home, like maybe home health? The other thing you want to look at is your care complete. Have they received all the necessary treatments that they've done in the hospital? You also want to look up at follow-up appointments. You want to help make sure their follow-up appointments are scheduled. That kind of stuff. So also medications, you want to make sure that they have access to the medications. If they need prescriptions, do they need handwritten prescriptions? Can they be called into pharmacies? If they need any one of those, make sure that those are done before they leave. And make sure they have a good understanding of education. Do they understand everything that they've been taught and told? The other thing that you're going to give them is something called a discharge summary. And it looks different depending on the facility, but basically it's a written set of instructions for them to continue their care or their follow-up. It'll have things like their follow-up. It'll have their meds in there. It'll have any like dressing changes or instructions for dressing changes. This piece of information is really important because what this does is it sets them up to be successful. And it also makes sure that they have the resources they need so that they don't end right back in the hospital. So we've gotten to the bulk of discharge, but there are a couple of situations that I want to talk where the patient wants to either leave in the middle of treatment or before being treated or before we would want them to leave. So the first one you're going to look at, and you'll hear a lot of this, is AMA, which is against medical advice. This means that the patient knows and understands that they've been advised to continue medical treatment and they are refusing to do so and they're leaving. The thing that they're going to have to do is they're going to have to sign a form, and that form will stipulate that they're leaving against medical advice and they understand the risk that they're taking in leaving. The other one that you're going to see is called LWBS, leaving without being seen. It's more common in emergency rooms. It's considered a discharge technically, but basically they show up in the ER and they're placed in a room and they're waiting, but they decide to leave before being seen by a provider. So commonly your patient will wait in the waiting room and then decides to leave, either because they don't want to wait anymore or for some other personal reason. So for transfers are similar to discharges, and the big thing that you want to focus on here is being an advocate for your patient. So is the transfer appropriate? So an inappropriate transfer would be like a medically unstable patient, but sometimes the facility that you're in can't handle that type of patient, so they actually need to be transferred to another facility with a higher level of care. That would be considered an appropriate transfer, considering that you're actually making the move to help the patient better. So always think about that. Is the transfer appropriate? Transfers can be to another unit. So we could go from the floor to the ICU. Sometimes a patient needs to be transferred to another facility. So sometimes you'll send them to like a skilled nursing facility or a long-term care facility, and family can also make this request. One other thing that you need to think about when we're talking about transfers is, how does the patient get from point A to point B? So we want to make sure that they have a way to do that. And sometimes that's an ambulance or it's another transport service that takes them. And this is called method of transport, or MOT. The final important piece of information in a transfer you'll give is report. This guy. There's a whole lesson on giving a report and the ins and outs of that, so be sure to check that out. But our responsibility with transfers is to make sure that it's an appropriate transfer and to make sure that the patient has a way to get there, and also to give a report to the nurse receiving the patient. When we talk about nursing concepts for admissions, discharges, and transfers, we're focusing on the patient, and we're talking about prioritizing the care. We want them to get to their illness as quickly as possible, and we want to focus on efficiency and promoting health in all aspects. So let's recap. Admissions, they are lengthy processes, but remember, your discharge plan begins here. You want to work to get a solid history, and you want to help establish your patient for their stay. In discharges, you want to start planning them quickly. So you want to make sure your patient is ready for discharge, and you want to educate them. When a patient doesn't know what they're supposed to do or when to follow up, it can lead to readmission to the hospital. So always start educating them early. When we're transferring a patient, know where they're going and if they should go and where they should go. If you know your patient, you can make that transition smooth for them. So know your patient. The last thing, always make sure that your patient is where they're supposed to be. Do they need to be admitted? Are they ready to be discharged? Is the transfer to a different unit going to help or harm them? Ask yourself these questions when you're talking about an admission, discharge, or transfer. All right. Admissions, discharges, and transfers on the surface don't seem like they're that important, but they really are. Know the where and why of where they're supposed to be, and that will help your patient have really good outcomes. So be sure to check out the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.